We're both first years.
Second years.
They're nervous.
I'm Claudia, and I also just graduated from USC in May, and I'm a first year.
I'm Myra, I'm from Texas. I'm a third year doing my rotations in Columbia at the VA.
I'm Casey. I'm a third year also. I graduated from Auburn University, and I'm doing all my rotations at all the hospitals in Columbia.
And I'm John. I'm a second year from Connecticut, and I graduated from Clemson University.
Not here, man.
Did you tell me this earlier?
Hostile territory.
So I have a question. So what's the difference between DO and MD?
Here it comes. Who wants to start? Anyone?
Right here. Yeah.
All right, I guess it's on us. So it's one of those things where once you're in it, there's a ton of similarities because a good doctor's a good doctor no matter what school you go to, and that's kind of how most people look at it. That being said, my background in undergrad was actually physical therapy, so I really like hands-on things. With osteopathic medicine, you get to do a lot of that stuff and also learn all of your typical medical care, which comes with allopathic physicians or MDs. We really go on like this patient-oriented, holistic approach to where, okay, a patient comes in with a complaint of such and such. But we also look at lifestyle habits, diet, everything that you do that could also be contributing to your symptoms instead of, let's just say, you have a cough, let's treat that. That being said, that's just kind of our foundation of training with that. MD schools also do that, but it's just one of those things that's a core value with ours is to look at whole person and kind of go from there. And then also take this approach, whereas anybody familiar with, I hate to say it, but like chiropractics and physical therapy, everybody's probably had some kind of injury. You've seen a physical therapist before? Some head nods, okay, fair enough. So we do a lot of musculoskeletal work too, so we have a pretty good understanding of that because a lot of us actually go into family medicine and kind of combine this mix of treating musculoskeletal issues without medications and then also handling like everything from your cough, cold, snotty-nosed kids, you name it. And kind of just having that whole didactic skills to be able to treat everybody with this large encompassing thing. But like I said, once again, good MDs, bad MDs, there's good DOs, there's bad DOs. It's really just specific to when you look at a school, no matter which one you want to go to, make sure kind of what they're talking about fits with how you want to learn and the kind of physician you want to be, and then pick that school, whatever's best for you. Because I don't care where you go. I'd like you to come to my school, but it's more important that you just become a phenomenal physician because you went to a place that kind of fostered your ideologies, and that helps you train and enjoy where you're going. So that might answer some of it.
And I think one thing to keep in mind is that you can go into any subspecialty you go into. If you're going to go to an allopathic school, you can do the same thing being an osteopathic physician. Just the way we kind of go about it, as Casey said, is a little bit different. It's a little bit, we would like to think more patient-oriented
Yeah, a lot of them emphasize primary care though. I mean, you don't necessarily have to become a pediatrician or a family medicine doctor. There are obviously a lot of surgeons, dermatologists that happen, but.
So it's usually the school that's split between osteo and allopathic.
No, I think it's different schools. So you guys will apply to an MD program through a whole different avenue versus you apply to DO programs through AED, right?
Yeah, there's two separate. Once you go, like once you decide what you want to do, and a lot of people go to both. Because the best thing is pick like 15 schools or so, because you're going to have to apply to the con. Because as you well know, you get into med school, you're like, sweet. It doesn't really matter where you go. You really want to become a doctor. But when you're applying to the MD schools, there's a whole group that you apply for that. Just like I guess if you lived out west, you take the ACTs. Over here, SATs or something like that. And then when you apply to osteopath schools, there's a whole application system for that. And they're separate, but it's a lot of the same type stuff. And then you go from there to doing all your interviews.
You still take the MCAT, you still have your personal statement, it's just a different kind of application cycle.
There's got to be more questions.
Got plenty, man.
Sweet.
Plenty.
Keep them rolling.
So when you apply for a DO school, do you have to shadow like a DO doctor, or can it just be any kind of physician?
So what they want you to do is, it's just as anything. Like I was talking to one dude that's he's been an EMT, and once again we're going to hit on stuff that helps you get into any med school. But nowadays, everybody gets good grades for the most part, and everybody kind of looks like rock stars. The thing that sets you apart as a physician or someone who wants to become a physician is, do you have any experience and can you speak to what a doctor's life is actually like? Because just good grades doesn't really mean anything in the sense of how do you know you really want to become a physician? So being an EMT, a scribe, such and such, all these things that kind of give you a good pre-medical foundation to where when you're doing your interview and they're like, well, why do you actually want to become a doctor? And you give out some answer, but you have nothing to really back it up. They're like, okay, next. But what's important for us is that you do shadow a DO. They're kind of all over the place. You can Google it and you'll find them. Like they said, in family practice, there's actually a ton in Columbia. And just to get some time in there, because that's one of the people that has to write a letter for you when you're applying to the schools. Just as like you're going to need professors to write letters and different positions. So most of the time, it's a pretty tight-knit community where somebody's going to know somebody. And it really helps if the DO that's writing you a letter knows somebody at the school, because then it's like, oh sweet, talk to my boy and such and such. So.
Over there.
You can
All
go.
right, man. All right, man. So maybe each one of you guys explain why you picked DO over MD.
Well, for me, I'm really interested in preventive health, kind of what we can do to stop chronic diseases before they happen, cancer, diabetes, that kind of stuff. And being in DO school, we learn a lot about the body as a whole, like Casey said, holistic health, and how not only we can treat things with medicine, also how we can use OMT as well, which is the manipulations that we learn. So it's kind of nice having this other avenue that we don't have to put our patients on drugs all the time. And that, that helps prevent side effects and that kind of stuff. So that's why I did it.
I applied to go to MD and DO school, and then wherever I got interviewed, I went, and then wherever I got accepted first is where I went. So got accepted to VCOM.
I'm kind of a mix of both. I applied to both as well. And I also know that DO schools are really known for producing really great primary care physicians. And that's what I want to do. I want to do pediatrician, so I know that's why I like that. And I'm a first year, so I'm just like, I didn't know much about DO school until I applied. I didn't even realize my own physician was a DO until I went in for a visit, and she prescribed me something, and I was like, oh, I'm applying. So really, there's really no differences, except like the way they like approach you when they're treating you, and you can tell like that.
Yeah, I didn't want to be one over the other. I just wanted to be a doctor, so I applied to both. And VCOM was my first interview, first acceptance, and I just went with it, and I have no regrets. Yeah.
Like I was saying, with my background in physical therapy, it was kind of just going to an osteopathic school was just kind of an extension of who I was and how I wanted to treat. But that being said, I really want to do emergency medicine, and you kind of learn that once you get into school and the field you want to do, there's certain things that you will or will not be able to do based on time constraints. With emergency medicine, it's not going to happen as often that I can spend enough time to do the different manipulations, but it is there. And it was just kind of an extension of who I was, so it worked out.
Yeah, I have a similar background to Casey. I worked in a PT clinic for a while, as well as an emergency room. I specifically chose a DO school because I want to do sports medicine and like a rehabilitative kind of medicine. And so DO really kind of speaks to me because it's just the physical manipulations. Why not, like when I graduate, like promote to somebody that here I can help your athletes in like an allopathic sense, but I can also do these manipulations to help treat them that way. So it just kind of seemed to fit perfectly. If you want to do like that sports medicine or something like that, you can not only give these medications you need, but you can physically treat them almost like a chiropractor or a physical therapist would, and you can like give them that immediate impact that they need.
In a hospital setting, do they really look for osteopathic background, or are they looking more for just sell money, quick drugs on the patient?
When you get to the hospital, it's kind of like if you play sports and stuff like that, and we're seeing it now. It's all about the physician that the other physicians really want to work with. They kind of, once you get past your boards and stuff like that, they're like, it's even playing ground, we don't really care, do we want to work with you or do you not? And if it's someone that's going to work hard, and honestly, it's kind of funny, but actually get along with the other people, because there's plenty of people that just don't. That's who is kind of a rock star at the hospitals, with those that they're willing to help out, doesn't matter what it takes. They're just going to get it done. As in, like, are you MD or DO? It's really kind of irrelevant with what you do in that aspect. It's just, are you going to put the work in and kind of go from there? So.
Going off of what you said, we have like our own residency programs as well. So there's MD residencies and DO residencies. But as DOs, because we get the training that allopathics do as well, we can apply to both. So you really can choose if you want to do an MD residency or DO residency. So we have that. MDs cannot do that. They can apply to DO residencies because they don't have that training of OMM, but we do, so we can.
What's up, did you have a question?
Yeah, I know this, I may not know how to word this question, but I know healthcare is changing a lot, like as far as government really limiting the amount of time doctors can spend with patients.
Mm-hmm.
And I was actually watching a documentary where like this osteopathic doctor was saying that he was finding it really hard just to really treat in a holistic way as quickly as the government wants him to. Does that make you guys nervous at all? You're not gonna be able to treat your patient without
No, it's a great question.
They're more about throwing the drugs out there, like you said.
Right, and you have to
patients
figure
in.
out, yeah, it's when you're seeing patients, you have to figure out, most of the time they train us on like you get 14 minutes to go in, figure something out, or fake like you know what's going on, and then diagnose, treat, and send out. Now, with that being said, most patients you'll find when they're actually satisfied with their treatment is if you actually do something, even if it's just listening to heart and lungs. You'll find a lot of physicians don't. You can carve out that time. It makes it more difficult, but if you go to med school, you're up for a challenge already. So that's just something else that you'll kind of build into it. But just something as quick as 5 minutes, a quick treatment, because most of our stuff is really, really fast, and the patient satisfaction is what's really high. So when you get into the hospital setting, you'll see that everything's kind of driven on, are the patients happy? Are they satisfied with your care? So when you're doing stuff like that, our actual, like when we sit down and we review like who's doing well, who's not, these people do really, really well. And that's MD and DO. Anybody who's just going to take the time, listen, and actually lay your hands on a patient. Because now there's so much stuff you can do with technology that you never actually, we kind of lost that old school sense of touch and taking care of somebody. But within 14 minutes, once you get trained up, it probably takes me an hour to actually treat a patient. But once you get trained up and you get good, there's no reason within 14 minutes that you can't do that and all that kind of stuff. Obamacare, that kind of hurts everybody in the sense of time constraints. Because it's like you have to get people through, and it's just patient throughput. But that's for everybody. That's MD, that's DO. It's just you want that. You would like 30 minutes to sit with the patient to figure out everything. So it's not something that is affecting us more or the other. It's just good medicine should never have that time constraint. But that's kind of the reality of where we're at, and that's across the board.
And I think a lot of our clinicians are really good, especially our professors who are DOs are really good at kind of integrating a lot of stuff like that into what they're teaching us, maybe kind of telling us how to save time by doing 2 things at once, or talking to the patient while kind of doing your exam. And I mean, that helps me when we're doing our standardized patient. We have, at the end of each one of our blocks, our curriculum's divided up into different systems. So at the end of each block, we have a standardized patient, which is like a fake patient. And so, like he said, we have about 14 minutes in our second year to go through that, and that kind of instruction by our DO professors helps a lot by teaching us how to kind of multitask.
And if y'all have questions too about the actual application process, and I mean all that stuff, MCAT too, oh I did bad in organic chemistry, my life's over, feel free, oh there goes a hand. Feel free to ask about that stuff too. So, yes, what's your question about?
What kind of questions do they ask you during your interviews?
Well, I did interviews for a lot of the students, so it's I'll cheat. So,
Yeah, go ahead, since you.
no, y'all go. I'm talking too much.
What do they ask? They ask why we want to be a DO. That's kind of a spiel I think we all kind of have set in our mind why we wanted to go into osteopathic medicine. So that's something you should definitely research. That's what I did. I kind of looked at the mission of the school and kind of not tailored it, but found out what's important to me as far as that goes. And I don't remember what other questions they asked.
Just ask us of like what you like to do on your free time. How do you, like, if you're really stressed, what do you do about it? I don't know if that's what I got asked.
I got asked a few like ethical questions because my professor who interviewed me was our ethics professor, but it was more like situational. Like you go into your office and your colleague, smells like alcohol. Like what do? You can't let them see your patient, but you don't want to be like you're an alcoholic. So just kind of like situations like that, kind of be prepared, because I wasn't expecting that, but be honest.
And a lot of times they're not looking for a right or wrong answer, they're just looking for you to kind of rationalize it in like a ethical way, I guess. But they ask you a lot about your undergrad, I guess, activities you did and that kind of stuff. If you did poorly, maybe they might ask you about some justification of those grades, but
Yeah, I think it's, with that, obviously if you have some scores that are lower, they're going to ask you about that. And it's not because they're like, oh, this gets you out. Because what I've always told people, when you get the interview, it's kind of yours for the taking. Because you've obviously passed, you're pretty much 1 out of 20 people that were already qualified. So you're sitting in a good spot. If you get the interview, just don't jack it up, because it's really set up for you to do. Well, the stuff they want to look at, and what I looked at when I'm interviewing people, is whatever you're doing right now, how is that integrating to you actually becoming or being a good physician? So if you're involved in such and such club, or you're a leader in this, or you're volunteering in that, how does that parlay into you being a good practitioner? Because that's kind of what it's all about. What you're doing right now, don't just do it just to so-called look good on paper, but let it be something that's going to be an extension of you as a provider, as a medical provider. And when you can do that in your interview, it's really, really easy to make things happen, because you're like, okay, I noticed you were ahead of this club. And then you might get a question about that, and you'd be like, and this is where I'll be a good leader when I'm on, like, let's say, an emergency medical team, and I have to keep everybody stable during such and such activity, like between your nurses to your janitor, all that kind of stuff, and how to do that. So those are really important things that right now at the stage that you're at, to be able to do and get involved in and speak to come interview time. So.
Yeah. Also, I kind of cheat a little bit when it comes to that. There's a website called, was it studentdoctorportal.org or something like that. If you Google that, they have almost all the med schools listed out. And it's a specific forum where people who have interviewed can go on, and they'll tell you some of the interview questions. And I went on that, and I knew probably like 4 of the 5 interview questions I was going to be asked.
yeah, I kind of had, I know you guys will probably kind of talk with Eileen a lot about the application process, and I talked with her a lot throughout my application process, and there's a lot of resources there as far as typical questions that are asked on an interview at any school, whether you're going to apply to allopathic or osteopathic schools. I know I applied to both, and a lot of the questions were very similar, minus like obviously DO. Schools want to know why you want to be a DO, but that's a good resource. And they do ask a lot, for me at least, they asked a lot about my personal statement. So, I mean, know what you wrote, I guess.
So,
what is each of your individual study regimens like? What works best for you? And have you tried anything that did not work?
Well,
Especially.
Ina and I studied together. We kind of, we do each lecture on our own. And at our school, all of our lectures are recorded so you can rewatch them again. So we kind of go through our lectures together before a test, and then the day before the test, we have a study group, and we just go lecture by lecture, slide by slide, and talk about what we think is important. And that works really well for us. But you have to kind of find out your own study schedule, and it's trial and error. It really is.
I feel like I'm still like figuring out mine, because I just started like 4 weeks ago, and it's not the same as what you think undergrad is at all. Like you go in the first 3 weeks, I really did not think I was gonna make it. I was like, I don't know what's going to happen, because you have exams like piling up on you, and it's not like you prepare ahead of time, because it's kind of like you're always trying to catch up. But it's definitely like you get into it, and different classes have different study methods. Like I thought I could study the same way for every class, and I learned that I can't. So I do kind of like what you guys do with like say biochem, where I can just like kind of talk my way through it with a friend, and then other stuff that are like straight memorization, I kind of like sit there, stare at my paper, and put things in there. So you'll figure it out.
Yeah. I have to study alone. It's just how I am. I have to be quiet. Other people stress me out when they like say things that don't click right away, but I know that I know it. And I'd say 3 is the magic number. Like during class, I would take notes. That's the first time. The second time, I would review it before the test, and the third time, the day before the exam. And by then, you kind of have it memorized. So.
yeah, I think I used to rewrite all my notes in undergrad. I think it was about the second day of med school that I stopped doing that because I couldn't hang.
Do that.
But like she said, 3 times usually will give you enough of the foundation with the information. That's really all you're going to get too, because it always, it will never hurt you, obviously. And once again, it's just like, interviewers look at it as not so much of just did you do it, like is it on your sheet, but it just shows another thing you can manage on your course load, because come med school, just managing the course load is incredibly difficult. So if you have all these skills and you're well-rounded, you can take care of all that, that's what shows then that you'll be successful in med school. It's not just like a typical, you know what I'm saying? Like there's a ton of hours that you're going to, your life is kind of gone in med school due to the amount of work that you have. But if you can stay really busy in undergrad and manage all that kind of stuff, then like, you'll be able to go to the next level and be successful. So that's kind of what it comes down to.
If you put down research, make sure you know your research. Just because, like, sometimes you're in a lab and you're just kind of doing, like, you know, pipetting stuff, and you don't really know what you're doing, and you put that on your resume in the interview, talk to me about your research, and it's like, oh. they want to know. So just make sure you know, and make sure you, like, refresh on that before you go in, if it's on your resume.
Was there like one particular class that stood out to you that you really struggled with in undergrad?
Physics.
Yeah.
Yeah.
Physics.
I'm pretty sure that was why I hurt my MCAT score, but again,
it's just like discouraging.
What's discouraging? Which class are you talking about?
Yeah.
Just talk to me after class, I'll help you out.
You won't even use it ever.
Yeah.
No.
That's like the best part.
Do y'all have to take biochem for the MCAT now? Or to get into med school?
2015.
Okay. But here's my advice on biochem. If you don't have to take it, too bad you need to take it anyways. Because once med school starts, like that's pretty much your first block is getting smashed with that. And maybe you might be scared that, oh, it might hurt my GPA in some here, but I promise you, when it gives you an extra 2-3 hours a day in med school to study other stuff because you have a foundation in it, you really want to do that. So take biochem. That's what I would say, because I didn't, and I was like, man, this is pretty brutal come first block. I wish I had done that, and all my other friends that had taken biochem were just trolling along and stuff. So
I think right now that's where I spend most of my time, like biochem, like every single day. I need to sit there and like, oh. So
Yeah, biochem is really helpful.
Yeah.
Because I took a lot of biochem in undergrad, I really liked it, and that helped me a lot first block of med school because it's all basic science review, so a lot of it's biochem. I know a lot of my classmates struggled a lot with it.
Yeah, our class. It's tough.
I guess kind of what she said, like, one thing that really stresses me out, and physics too, because I hate physics more than anything. And like, I spend a lot of my time feeling like that if I get one bad grade, my chances are just shot. And I don't know. It really stresses me out. And I know that's not really a question, but I want to, like, my first thing that I want to ask a med school student is, did you ever feel like that? Because I feel like I'm the only one.
You're not the only
So that's generally how most med students feel, because they're all like freaking out about grades constantly. So probably everyone worries about their grades, maybe even a little too much, but you're all like high achievers. This is something you want. But like a bad score on stuff, my biggest thing is don't let that stop you. If you let that define you, then yeah, it's going to keep you out of school and stuff like that. And yes, it may be harder when you're talking to all the academia of med school about, oh, I had this one bad grade. But once again, if you can speak to it like in an intelligent manner and show that that was a challenge, but hey, you've overcome it, or you know what, it whooped your butt this time. So what? It's one little thing. Like there's so much more that goes on with it. So just, even if you have a, for most of y'all, if you have a rough, or not, I'm not saying you guys are gonna have a rough MCAT score, but if the first time you do it, it doesn't go how you want. Once again, if you let that score define you and you're like, oh, I can't get into med school now, then you won't. But I know plenty of people that took it 3 and 4 times, ended up doing really well on it and stuff, because they were just like, I'm not going to stop. And that's the kind of person that's going to make a great physician. Like, I'm not going to stop. This one class is not going to deter me. So if you get a bad grade, 2 or 3, maybe 4, it's not the end, man. I promise you. Like, you'll be able to pick it up somewhere else, play to your strengths, and just keep going.
Yeah, if you didn't have a bad grade before med school, you'll get one when you get into med school.
Not worried about it.
There's the first time. But
Yeah, like, I'll just get in, that's fine.
yeah, but no, there's nothing. Don't let one grade define you. It's there's so much that goes into the process. They're not gonna let one bad grade like screw everything up. It's really a holistic thing. They're gonna look at how well-rounded you are. They're looking at everything. I mean, everyone drops the ball every once in a while in class. I mean, I'm sure everyone here can say that they had a bad test grade. Just stay dedicated and show that you're committed to what you're doing, and that's really all they want.
Speaking of grades, since we're on topic, so there's kind of this like stereotype with DO schools that in terms of applying, there's not as much emphasis on numbers, and so there's some people that obviously, that's why they apply. And so I know that all of my friends last year that got into medical school, they all had 3.8s, 3.9s, and I made Dean's List past 3 semesters, but I only have a 3.4 because my sophomore year was chock full of mistakes, and so I've kind of been coming back from that. And so I plan to make 4.0s the next 2 semesters, but then I graduated, and at that point, this many semesters already piled up. Even though I make 2 4.0s in a row, I don't know if it's necessarily going to pull it up somewhere that's, it might be somewhat competitive, but not really enough to really give me a good, solid fighting chance. And so I didn't know if you kind of had any input onto what kind of, if there is a certain range that is really just solid. I mean, I know anything, obviously 3.9, it's obviously solid, but like in terms of DO school specifically, how true is that stereotype? And what are a lot of your friends that are in, were they all 3.8, 3.9, 4.0, or were they kind of a little bit all over the place? Or?
So, because I have a lot of friends from being up in Virginia that are at UVA, which is obviously an awesome med school, 2 people that have gone to USC to MUSC, and MCATs are all across the board. I know people at USC and stuff in USC that had a 26 on their MCAT. My roommate here made a 36, so that's all over the place. GPAs, once again, like you like being above the 3.7, but because I did interviews and stuff, I saw or was aware of GPAs that were in 3.4 ranges and 3.5s because someone did have maybe a year that it just didn't work for them. It's one of those things where, like I was telling this guy, it's not the end all be all, and you might get in and get a good interview with someone who's like they're going to attack that and kind of figure out what's going on, but it's not the end of the world for stuff. Yes, our average GPAs, like on paper, like some people they're lower than maybe some of the like obviously Harvard and crap like that, but than different MD schools. But there's people that range all over the place. You just kind of have to figure out what's going to work for you and go from there. And if you're at a school that's like, you had 1 semester that was bad, do you really want to be there? Kind of thing. You have to look at that too, or where some place is going to give you a fighting chance, and not look at that as just the one fault that you have, So is there a GPA discrepancy? Yes, but MCATs are all over the place from MD to my school. And it's just kind of one of those things where all you can do now is work your tail off and submit your information and see what happens. You may have connections with people, who knows, and kind of go from there, but don't let it, like, in a sense, scare you off of exactly what you want to do.
And I think one big reason DO schools you might notice they don't pay attention to numbers as much is because, at least at our school, you kind of look at the whole student. I know we keep saying that over and over, but that is really something that I believe that our school looks at. VCOM does look at the whole student and everything that they've done and how they would fit well, not only into our school, but as an osteopathic physician as well. And that's something that if you're interested in that type of medicine, it's kind of something to think about to tailor yourself to.
You can find averages for MCATs and grades on their websites all the time, so you get an idea where you stand in comparison.
You guys mentioned earlier about how biochem really helped you out taking an undergraduate. Is there any and I an example I saw online about somebody who took an anatomy class and really threw them off. They were having a good eye over there and having to spend time dissecting and stuff. Is there any one class you'd say that you took in undergrad that just really kind of helped you in med school?
I mean, for me, it was biochem.
And that didn't matter in my career, but it's not.
Yeah, I took anatomy and I took physiology with Dr. Duggan, so that really helped me a lot. So you guys have him. I don't know. I mean, I'm sure he's a great professor. He just didn't work for me. Yeah. pharmacology, we have a little bit of organic chemistry, and that helps me to learn it. It might not help other people. Like I know you tend to like it, but it helps me like understand how the drug works a little bit better. So if you pay attention, you probably.
Neuro helped me a lot. People did not have any neurology at all, and a neuroanatomy killed them. But if you take a neuro class, it's too bad.
Maybe genetics.
You have to take that.
Yeah, they do.
Yeah, you have to take that.
I didn't take biochem, and I did fine, but you just have to, make sure you work hard and understand it. But I don't know.
Yeah, I think.
Nope, we got a new one.
What were all you guys majors?
I was a bio major and chem minor.
Same.
Value major, psych minor.
Psychology major, music minor.
I did kinesiology.
I did bio major, party minor.
So I like that.
Well rounded. Yes, ma'am.
Did any of you take a gap year, and if so, what did you do?
I worked in the ER for a year. If you take a gap year, the biggest thing I was told when taking a gap year is don't just take it to travel the country and tour with a band or something like that. Take it to get some experience in something. That's what set me apart, I think, a lot in the interview process and stuff. I worked in the emergency department for a year. If you're gonna take a year,
For 9 years, and then
Yeah.
go back to school.
yeah, there's no, a lot of people do that too, yeah. There's nothing wrong with taking time off, but just make sure like you're doing something that, like it's something that you can apply to the med school process and applying process. Make sure it's worth the time off you take to take the time off, but there's nothing wrong with it.
For your school, like for the last 2 years of rotations, do you guys stay in Spartanburg or do you go other places?
We have sites like all over Carolinas, kind of. We have Columbia, Anderson, Spartanburg, Charlotte area, Myrtle Beach area.
So you guys move to that area?
You're there for like a year, and then 4th year you can do away rotations like wherever you want. If you want to set those up.
Yeah, so the breakdown is second year, finish your boards, and then you pick kind of a hub of sites. So like she was saying, Anderson is a really good place to train. Obviously Columbia, because we're in Richland and all that kind of stuff. Spartanburg, there's a lot of places to train. And Charlotte, these are kind of like our hubs where we train out of. And usually there's maybe 2 or 3 hospitals that you kind of float between, which is good because you get pretty good exposure to how different hospital systems work. Come the end of your 3rd year though, you're already thinking about where you're looking at for residency. And what you do is you do a bunch of away rotations that are pretty much like 1 month long interviews at whatever site you want to go to. So I want to do emergency medicine at MCV up in Virginia. So I'll go there. So most of your 4th year, there's a couple that you'll still do in whatever your core site is, but you're pretty much gone, just kind of a gypsy around different medical sites. So
We'll have one more question. I have one question. So, so in terms of price for VCOM, is it comparable to USC med school or cheaper?
much is USC?
Or 28 for tuition.
We're a private school, so our tuition will be a little bit higher. I think it's
So
around.
one of the lowest in the private ones. Yeah.
Oh, so in the 30 range maybe?
It's like 40,
40?
39.
39.
$1 million.
Yeah, a lot.
That's what it feels like at the end.
Well, thank you guys for coming in. Is it cool if you guys put your name and email address up?
Yeah.
Also,
And people,
guys, sorry, I'm
Oh,
so
no.
sorry to interrupt you, but if you guys want to sign, there's a sign-in sheet here. Just put your name and email address in. We don't send out a lot of stuff. We might have our admissions send you guys one email, and if you're interested, definitely keep track of those. And there's also folders with lots of information in them. They
Tells you
kind of,
what a DO
yeah,
is.
talks about what a DO is, maybe a little bit better than we could explain, and a lot of information about our school. And there's also a flyer for our open house. It'll be on November 9th. So we hope to see you guys.
November 9th, you said?
Yes.
Open house?
November 9th.
Okay, cool, cool.
All right, thank you.
Thank you guys.